The last person to propose a natural cure against cancer is Tullio Simoncini, an Italian oncologist who finds himself in the middle of a storm after having declared that the origin of cancer is not genetic, but it is due to the aggression of a fungus called Candida albicans. Based on this hypothesis, Dr. Simoncini treats cancer with sodium bicarbonate, which is one of the strongest enemies of fungi in nature. How does a fungus get in the body? Where do you think this all starts from years of research?
There is an endemy, a big epidemic pollution because the fungus is undervalued. But it is undervalued because it is not understood.
From the very beginning of his studies, Dr. Simoncini felt the need to reconsider the cancer paradigm from scratch and began looking for a different origin of the disease. What puzzled him the most was the fact that all tumors behave in the same way, even though they appear completely different from one another. Then he started looking for a common denominator and eventually found one. Most cancers appear white. These tumor specimens show the devastating impact the disease can have on the body. This is a liver riddled with cancer. The white bubbles are all tumors.
If you enter the body and you reach an organ affected by the cancer, you can see that the lumps are always white. Sometimes it is covered with blood or with the defense reaction, but in every post-mortem examination, scientists find the white lumps, the white masses, that is fungi. This is the pleura. We entered with the camera and look, the pleura should be red, but you can see all the lumps, all the cancer that is white. This is a forbbiden. This is a bronchial cancer. Look, we went into the bronchia. Look, they are white. And then in the colon cancer, this is red because there is a little bit blood. I washed it up. Now, look, it is always white.
White like Candida. Candida albicans in Latin means glowing white. It should be clarified that the presence of fungi in tumors is nothing new in the medical world.
All the scientists find in the oncologic world the cancer patients, when they die, they are all invaded by the fungi, but nobody wonders that this is the only microorganism present in cancer patients.
Official oncology, however, believes that their presence in tumors is due to their opportunistic nature, which brings them to build colonies wherever they find a suitable environment. This belief, though, seems contradicted by a careful observation of the animal world.
Spores from a parasitic fungus called cordyceps have infiltrated this ant's body and mind. As soon as she is discovered by the workers, the ant is taken away and dumped far away from the colony. It seems extreme, but this is the reason why. After a while, the fruiting body of the cordyceps erupts from the ant's head. It can take 3 weeks to grow, and when finished, the deadly spores will burst from its tip. Then, any ant in the vicinity will be in serious risk of death. The fungus is so virulent, it can wipe out whole colonies of ants. And it's not just ants that fall victims to this killer.
In this case, it was the fungus that caused the ant's death, not the death of the ant to invite the presence of the fungus. What normally appears to be a simple opportunist is in fact a full-fledged assassin.
Allora viene il dubbio, non sarà che viene prima debilita l'organismo e poi nel momento in cui la si vede è il momento della massima invasione? Chi ci dice che sia solamente un post hoc? Il fatto che ci sia è un dato di fatto, il fatto che sia un post hoc è un'interpretazione.
Not all infections are bacteria. There are also the fungi. Viruses, smaller. Fungi, bigger. And fungi are the connecting point from the microorganism and the animals. So they can enter in a body like microorganisms, and they can aggregate once they are inside, and they can build a big mass that has the power of an animal.
Candida is a very familiar fungus, known especially to women, who sometimes experience an infection in their sexual organs.
The vagina is a muscular canal that leads from the outside of the body to the uterus. The warmth and moisture of this canal create a perfect environment for microorganisms to breed. For example, bacteria called lactobacilli, which are naturally present in the vagina, coexist with a yeast fungus called Candida albicans. Normally, the lactobacilli create an acidic environment that keeps the natural yeast population in balance. However, when conditions within the vagina change that either decrease the numbers of lactobacilli or decrease the acidity, these yeast fungi begin to multiply.
Normally, the immune system keeps the fungi under control and doesn't allow them to establish colonies in your body. This white cell spots a fungus in the bloodstream, attacks it, and destroys it. If the system's defenses instead get lower than usual, the Candida can manage to aggregate into small colonies practically everywhere in the body.
Il momento in cui un fungo entra dentro il tessuto, la parte interna dell'organismo, si chiama la candidosi intima, evoca una reazione di tipo immunitario cellulare che porta alla formazione del tumore. Il tumore, secondo me, sarebbe quindi l'insieme dell'invasione fungina più la reazione cellulare che l'organismo mette in campo.
Far from being a wild, uncontrolled cellular replication, according to Simoncini, the growth of a tumor is a lucid and desperate reaction from the organism in an extreme attempt to reject the intruder. By the same token, Dr. Simoncini believes that metastases are not cancerous cells that leave the primary tumor to go start a new one somewhere else, but small groups of fungi belonging to the primary tumor that fall into the bloodstream during biopsies or during a regular surgical operation. These runaway fungi settle in a new environment and prepare to take advantage of a weakened organism to establish their new colony. Once this propagation has started, it becomes necessary to restore the immune system to its maximum potency as soon as possible. If the patient is given chemotherapy instead, this only accelerates the destruction of his natural defenses, as the drug kills indiscriminately cancerous and healthy cells. While possibly prolonging the survival by a few months, chemotherapy makes it impossible for the organism to recover its defense capabilities, making it bound to succumb, sooner or later, to the multiplying fungal attacks.